right, well, welcome back, everybody. Orthopedic Surgical Partners is dedicated to delivering superior care here in Connecticut.
Now, here with us now is Dr. Michael Boniello, and we're going to focus today on shoulder issues. A lot of people complain about this. My husband included has been complaining all weekend of shoulder pain. Talk about some of the things. You know, a lot of it, I'm sure, is shoulder strain, but talk about some of the issues that people experience with their shoulders.
Yeah. So the shoulder's a pretty complex joint. There's a bunch of moving parts to it. A bunch of things can go wrong, and it doesn't mean that it's necessarily broken, requiring surgery. But there's a lot of irritations that could happen. You know, younger patients, people who play sports. You know, I'm a sports medicine surgeon primarily. You know, if they fall and tweak their shoulder, not even dislocating or anything like that, they could kind of get a strain of the shoulder. But as we age, and just really any age, you get bursitis, where there's inflammation that hurts like mad.
Yeah. And how does that happen? How does the bursitis happen? It just occurs, or?
Yeah, there's a whole bunch of different ways actually that it can occur. It could be kind of chemical. It could be kind of overall. We find that actually a lot of people with thyroid issues and diabetes can get frozen shoulder, and that's exquisitely painful. The relative position of the shoulder blade too can just cause impingement. People hear about impingement a lot. So, you know, we just work to correct any of those factors, and people tend to feel better.
Now, in terms of helping people feel better, are there non-surgical options that you offer that can help?
Oh yeah, absolutely. Yeah, we always aim to do non-surgical wherever appropriate. I mean, probably 90 to 95% of what we see is to completely non-surgical. Probably my happiest days are when someone is saved to surgery, and we could treat with anti-inflammatories. We can treat with injections too. Injections are very, very pain relieving, and physical therapy to correct any muscular imbalances really help.
Everybody hears about rotator cuff. Talk about that and what can happen there. There can be tears, right?
Absolutely, yeah. So the rotator cuff is a bunch of tendons that essentially keep the ball and socket located within the socket itself. And when they tear, they could tear traumatically. You know, if somebody falls and dislocates their shoulder, that's a traumatic tear. Most of the time that does need surgery because it's usually a very big tear. But beyond that, people get tears with age. It's not a very vascular, or there's not good blood flow to that area. So as time goes on, you could get some smaller tears, and that creates that bursitis like we talked about. And most of those we could rehab, and people live pain-free, happy lives even with them.
So these shoulder issues that we're talking about, are they for all of the population, like kids playing sports, up to older adults that maybe had a fall or something?
Good question. Actually, the tendons of the rotator cuff are so strong in the pediatric population, or even young adolescent, they'll actually pop the bone off before they tear the tendon. So it's more rare to see rotator cuff issues in the younger population. But as beyond 45, 50 years old is when we start to see them more commonly.
Yeah, because age has a lot to do with that,
Very
right?
much
so. You're just aging, and that's kind of what happens, right?
Yeah, very much so. So the prevalence of it certainly increases with age, and everything's a case-by-case basis. No patient is a number statistic to us, so we're very personalized with the treatment for that. And if we could save somebody's surgery, then that's
that's
goal.
good to hear.
I love when you say that.
Yeah, because nobody really wants to do that. Exactly.
Yeah.
And another thing, I've done stories at your place before. You have offices all over Connecticut, right? Rocky Hill.
Yep, Rocky Hill, Manchester, Avon, and then also in Willimantic, and we have urgent cares for the first three that I mentioned.
Which is great, because if you don't need an appointment. If you have an injury or a fall or something, you can just come.
Yeah, just walk on in.
Yeah,
absolutely.
Yeah, so you don't have to wait till Monday, like if it happens on Saturday. You don't have to say there's no place to go.
Yeah, yep.
Right.
We have X-rays on site. We a group of people to evaluate and try to make a diagnosis and treat you as quickly as possible.
That's fantastic. Thank you so much for coming in.
Absolutely.
Dr. Michael Boniello, we really appreciate your help. And for more information on this, or you can schedule an appointment too, visit OSP, it's right there on your screen, ospct.com. You can also find them at facebook.com/Orthopedic Surgical Partners. Thank you.
Yeah,
Thank you
thanks
very
so much. Good information there.